Hello and welcome to this mini series on meaning, purpose, and spirituality in lifestyle medicine. And today we have as our guest a American College of Lifestyle Medicine past president and also the chief health officer at Blue Zones LLC and a longtime friend, Dexter Shurney. So welcome, Dexter.
Well, thanks for having me, Liana. It's a pleasure.
Uh, and let's dive in. I'm really very curious. What is your core life purpose that drives you and has been driving you these all your life and especially more recently?
Yeah, I mean, that's a good question. And I will have to say that I haven't had the same purpose all my life. Perhaps the last 20 years has been different than the first part of my life and certainly career. Um, so I'll focus on that. Over the last, 20 years or so, what I've really learned to understand is the power that people have over their own health and their own health journey. And as many of us in the lifestyle medicine space, we have realized this because of personal experience. And I came from a family where, my mother died at the age of 59. I've had cousins that were healthcare providers that died, as early as 52 and 55. So I came from this family where we had these chronic diseases, type 2 diabetes, heart disease, cancers, and we were dying. And I was on that path. And I had prediabetes, I had high cholesterol, even though I was on medications. My specialty at the time and still is one of my specialties is preventive medicine. And so out of all of, out of anyone, I should have known how to prevent these things. And yet I came from a family with this. I was suffering from this. And it wasn't until I discovered lifestyle medicine that I was able to do for myself what a lot of us have done, and that is reverse those conditions. And now, some 20 years later, I'm on no medications for any of those things, and I don't think I'm going to die tomorrow from these things that my relatives have, unfortunately died from. And the other thing too is that while some of my relative friends have embraced these changes that I share with them, and they too have seen dramatic changes in their health status. Others, sometimes you're never a prophet in your own family, or you never know what you're talking about, like when you talk to your kids sometimes. Um, so they haven't adopted these, and of course, they have the same kinds of issues that others in our family for decades have had. But the ones that have made the changes have seen dramatic changes, such as I have as well. And so that has become the driving passion now in my life, not just for my family, but for patients, for organizations that I work for. As you know, I spend a lot of my career now working with large employers on the payer side, really trying to structure benefits and design those types of things to improve health and well-being for those individuals. And so the good thing is I get to match my passion with my career, which is very fortunate. Not everyone gets to do that in really meaningful personal ways to try to move the needle in terms of wealth and health being using lifestyle medicine as the foundation for that. So that, it's probably a longer answer than you were wanting, but again, when you get me going on something that I have a passion and a purpose about, that's what you get.
Absolutely, it shows, and you put it into context, and so thank you for that. And digging a little bit deeper, are there, or can you share some specific types of activities that really give you a particular deep sense of meaning?
I can. I spent a number of years with Cummins Engine, and so I ran their global benefits. And one of the programs that I was able to launch was disease reversal, and particularly around type 2 diabetes. And I tell you, Leona, it's nothing like having people meet you in the hall completely disregard PHI, right? And just shout at the top of their lungs, oh, thank God, I was able to reverse my type 2 diabetes, and I didn't even know that was possible. And that was because of this program that you started, Dr. Shurney. I am so appreciative to you, and I'm sharing it with my friends. I can't tell you, with tears in their eyes, right? And that's contagious. And it just makes you feel like you've really done something wonderful. And and again, my part in that, I wasn't actually the provider providing the care. I was the person in charge of the benefit design so that I could bring in providers to do that kind of work. And Leon, I have to also thank you in those early days at Cummins, because you helped us with the core competencies for lifestyle medicine for a lot of our providers too, because nothing like that existed back then. And we were kind of creating those things together. And I really appreciate your help on that.
Well, thank you. And what you're describing is that as the early instigators and innovators in lifestyle medicine, we have had, and you described wonderfully, these ripple effects. You created a program, brought in providers. Those providers have impacted these patients and individuals, and then occasionally you get the pleasure of getting some of that feedback, and that feels so good. And so
Absolutely.
that
Nothing
is
like it.
meaning. Absolutely, that is meaningful. Um, and then in around this construct of purpose and meaning, oftentimes that's connected to an individual's spirituality, their spiritual beliefs or their religious beliefs. So are any of those elements of your life important to you? And can you describe that a little bit?
Oh, absolutely. And so now you're really getting into it. So yeah, so I grew up in a religious family, and then I left the church. And as a young man, I didn't want anything to do with religion and church. And I had some things happen to me, and brought me back to the Lord, so to speak, and in a very meaningful way. And now I don't know what I would do without my faith. Um, I'm going to share something that not many people know, but even over the last few years here, actually the last 18 months or so, I was diagnosed with actually a cancer diagnosis. And I have to tell you that all of the things that we were doing to take care of that, I had five physicians, oncologists of various ilks working with me. I even uh, made trips to Germany to receive some care that wasn't quite available here in the United States, and nothing was working. And it really tested my faith and my wife's faith and our family. We had a prayer group going on this, and the Lord brought me back from the brink. And so it's a very real example of, my walk, my spiritual walk. And I'm glad you asked the question, because I think that we need opportunities to share those experiences. Otherwise, why would the Lord do miracles if you're not willing to talk about it, or if you just think it's a coincidence? And so it's very personal. It's very real. I did struggle a little bit with, why would I get this diagnosis of a metastatic disease when I was doing all of the lifestyle things, right? How would that happen? But there was a reason. And now that I can see myself clear of that, I'm just so appreciative. And I've learned faith, and I've learned patience, and to wait on the Lord, as the Bible says. So it really helped me spiritually, and I see it now as a blessing. And all things work together to get for good for those that trust in the Lord.
Thank you for having the courage to share that. And it can certainly, it sounds very inspirational, inspiring, what you went through, and the growth that you went through, and that it's helping you take a positive approach to this difficult situation that you faced. So that's wonderful to hear. And as we dig deep into how meaning, purpose, spirituality, religion impacts individuals and their health and well-being, mean, that's a common story, is how that can, having their values, having their beliefs, help them, support them, and give them strength and help them cope and be resilient and thrive through difficult times.
That's exactly right. And it gives you a resilience, you know. Um, yeah, there's a saying in the Bible that talks about you know, faith that passes understanding. And we don't understand all of this, but there's a power there that we can grab onto that really helps people with their resilience to get through these very dark times oftentimes, and also pain. There's a lot of pain associated with various diseases, and I can attest to that. I've never experienced pain in the way that I had during this time period. And they give you a scale of 1 to 10, and I would say sometimes it was a 12, and to go nights without sleep because you're in pain. And so, how do you get through that, right, without just giving up? And so, I think faith and spirituality play a huge role. I know it did for me in getting through those very dark times.
Yeah. And so you described how having that faith has contributed to your well-being emotionally, certainly, possibly even physically. Anything more to share about how having meaning, purpose, a sense of faith has really contributed to your overall well-being?
Well, I think it does, and also in the sense that you find companionship and friends. I didn't understand and know that there were so many elders that were on the same journey as myself. And that became also reinforcing in terms of the strength around it. And we could come together and support one another. And that's a big factor as well. And but you just don't realize it until, you know, someone sort of hears about your story and they call you up or text you, and then you connect, and then one leads to another. And pretty soon you're part of this larger community, and you're all sort of sharing and you're giving each other support. And so that was a good thing too. And you're actually praying for each other too, oftentimes. So that's good. It's a good thing.
And so we're speaking to the importance of these elements in our lives and for our well-being. So it's natural, actually, that our organization, our home organization, the American College of Lifestyle Medicine, is wanting to look into this and has a new initiative to look into the science and practice of harnessing meaning, purpose, spirituality, religiosity for promoting emotional well-being, physical well-being, and beyond, and really helping individuals become their best selves. I call that's the positive health journey. So we're coming together to look at the science. There have been areas there might not be science. We may be looking to expert opinion, and the ultimate goal is to have some advice for our colleagues in healthcare and in lifestyle medicine about how to harness this area for the well-being of their patients. And I'm just curious if you have any ideas about how we can do that.
Well, I think it's really laudable that ACLM is doing that. I think there's a lot of power here to help our patients. And while I've shared my story, and my story is more of a Christian focus, but I realize when we say spirituality, we're embracing a lot more than the Christian perspective. And there are other faiths that are not Christian, wed in Christianity. And I think they all bring to the table ways to engage with people and motivate and support people as well. And it was something that I also had to do at Cummins, is that we had a very diverse population, 77,000 employees across the globe. And so not everyone was a Christian, but yet most of the people we dealt with had some anchor of faith. And so if to the degree that you can tap into that, you can really help patients and motivate patients and give them oftentimes more hope and resilience than they might otherwise have. So I think it's a great idea for us to do. And so whatever that person is, you meet them where they are. If they're, a Buddhist or a Muslim or whatever, use that as part of your care holistic approach, personalized approach to that patient, I think is a good thing.
Great advice. And we are embracing all of our common humanity and being open to whatever our patients need and really making the most of their personal beliefs, whatever those beliefs are. Those beliefs can be a strength. And in lifestyle medicine and positive psychology, positive health, we do want to emphasize the habits and mindsets and beliefs that will help us be strong to have direct effects on our emotional, physical well-being, as well as help with our health behaviors and the things that we're all interested in for optimal health and well-being. So thank you so much for joining this quick touch point on meaning, purpose, and spirituality and lifestyle medicine, Dr. Dexter Shurney. And thank you. I'm Dr. Liana Leonov, the president of the Global Positive Health Institute. And thank you for joining. Take care, everybody.